to my channel, guys. Today is the day that we have all been waiting for, and I am super nervous, guys. Today is my first ultrasound, and guys, I've been up. My husband got up for work about 5:30, going on 6 o'clock, and I've been up like ever since. And I did not go back to sleep. I couldn't go back to sleep. I was like, well, I have to be there at 8 o'clock, so if I go back to sleep, I'm gonna have to like wake right back up. So I'm just gonna stay woke and play around on my phone, listen to my gospel music, and get my praise on, because guys, I've been praying like every day that today I get good news. We all know that with my other two miscarriages, the first one had a chemical, so I wasn't able to see nothing with that one as far as ultrasound wise. But we also know that my second one, they seen a sac but no gestational sac. But we also know I started bleeding and having real bad pain. But you know, as far as right now, I'm feeling wonderful. Besides feeling nervous, I am feeling wonderful, and I'm just ready, y'all. I'm like headed right now to pick up my sister-in-law, because unfortunately we went on vacation last week, and my husband had already took like some days off, so he's not able to go with me this morning, and I'm so sad about that. But it's okay, because I know that he has to do his husband and father duties right now and make us some money. So yeah, right now I'm headed to get my sister-in-law, and she was nice enough to be able to go with me and be with me today, because I am like super nervous right now. But I'm also believing in God to come out of there with good news. So guys, just hang tight, and I should be there in maybe about 15 minutes. And I'm so glad to update you guys today, and hopefully we will come out with some good news. In the name of Jesus, we will. And I'll see you guys when I get there, because I'm taking you guys to the doctor with me today. I just got my ultrasound done, and so far the lady couldn't say much, but she did say that the pregnancy is in my uterus, and from the looks of it, I am measuring about 5 weeks. But the doctor will confirm that when he come in. Y'all, I'm so excited right now. So as soon as I see this doctor, I'm gonna update y'all again. Okay guys, so I am back, and guys, it's like 3:15 right now, and I've been home since 11:15 this morning. As soon as I got home, I had something to eat, and I crashed. Like, my body was just tired and overwhelmed. So basically what happened is, when the doctor came in the room, she was really nice. I asked for a loving, caring doctor, so she came in the room. She was very sweet, and thank God she didn't like go through like this big questionnaire like the nurses do. So usually, you know, like the nurses come in there, then they'll ask you these thousands of questions, then they'll go back out, and they'll get the doctor come in, then the doctor come back in and ask you 1,000 questions. So that didn't happen this time. So what happened was, she came in, introduced herself. We talked a little bit about the ultrasound. She said that it was like 1 day off. Okay, so she asked me what was my first day of my last period. I told her. So it really did match, like my measurements did like match the what the ultrasound said. I think it was like just 1 day off, which was not a big deal anyway, but she said that we'll just go off the ultrasound. So it put me at like, I'm only 5 weeks and 1 day. But she said my due date is April 6th, 2021. April 6th. This is my first April baby that I have, so I'm excited about that. And as you guys know, that my last 2 pregnancies, they didn't see anything, but on this ultrasound today, we did see a sac, and we did see a yolk sac. So everything is like right on time. Like, everything is measuring on time, everything is looking good. I did ask her, I was like, hey, I'm at risk for 2 pregnancies, and she was like, well, that's right. She was like, that right there is out the picture, because your pregnancy is in your uterus. So I'm like, thank God. Like, yeah, I'm so grateful and blessed right now, because it seemed like it took forever for this day to get here, and it's finally here, and I got great news. So she asked me a little bit about my history, and she said that she needed to perform a pelvic exam, and she wanted to do like a prenatal, some prenatal blood work today. So she sent me to the lab. We got that done. She did my pap smear, did a bunch of different swabs. Yeah, so she did like my you know, after they do your vaginal, do the pap smear, they take it out and then they use their fingers to like just rub around and see what they feel. And she told me that my uterus, my cervix, she's either saying my cervix or uterus, but maybe my cervix. She said that it was like very high, and she said like it was like to the left side. So, you know, like when you got a high cervix, they like take that speculum and they have to find it, and then they, you know, prop it up or whatever. But I hate that feeling. It's aggravating, but I got through it. I had to breathe through it. She said everything looks fine or whatever. So I went to the lab, got my blood work done. So they did like all kind of labs. When I got down to the lab, I'm surprised that she didn't order me a beta or progesterone, but I guess now that she see my pregnant in the uterus, I don't know. But so she didn't order me that. She ordered me a whole lot of other tests. So I'm not worried. She's a doctor. She knows what she's doing. So guys, after I left the hospital, I took my sister-in-law home. I got home, I had some leftover spaghetti, and next thing you know, like, my body just shut down. Like, it's time to rest. And you know what, y'all, like, the crazy thing about it is now, like, usually I'm able to fight my sleep and stay up a little longer and watch TV, do what I want to do. But it's like, as soon as my body say sleep, like, I just instantly fall asleep. I have like no control over it. And so I went to sleep, and I'm still feeling tired, but I had to go ahead and get up and come to the pharmacy and get my meds. She did order me prenatal vitamins. She told me to take folic acid. I did tell her about my my heartburn. She said that's normal. She said it's probably gonna get worse, you know, as I begin to grow. So she did give me like a list of like medicine. She told me I could take Tums, but she told me Tums is like a medicine that people take at the moment when they're hurting. So she did give me like a list of other things that would like help my body not have so much heartburn. Like she gave me a list of medicines that help my body like stick to it. And also, y'all, one thing I didn't tell y'all, so she told me that she wanted me to see the high-risk doctor, only because of my past. Like, I just had 2 miscarriages. I can't remember detail about my last pregnancies because I have a 17-year-old, the baby girl is 11, then I have a 13-year-old and a 14-year-old. So I cannot remember everything about my pregnancies over, you know, long time ago. But the good thing is I'm at the same hospital that I had all 4 of my babies at. So she's able to like go in there and, you know, look at my records and everything. So she did that. And she came back in the room and, you know, she asked me some questions. So like maybe a few years ago I had, well, no, I think back in like 2010 or something like that. I went to the hospital for having like pain in my side, and they did a CT scan, and they found a tumor that was growing on the lining of my lung. So they did a biopsy and everything, and it wasn't a cancer tumor, so thank God for that. But it was a tumor called schwannoma. It was a schwannoma tumor, and they had to remove it. So she was asking me questions about that, and by it being on like the lining of my lung, it usually affects your breathing and things like that. But thank God I didn't have any of those symptoms. Like, I was just fine. Other than being in pain, I was fine. But I did tell her that, you know, after the surgery, they told me that I would have a, you know, a lifelong pain because the tumor is like up in here somewhere. So I do still, I think they like left like some clamps on there or whatever to keep it together. I don't know. It's been so long. But she told me that she most definitely need me to see a high-risk doctor. And she asked me that, you know, have I ever had problems with breathing, which I'm perfectly fine. But, you know, I see why she do want me to see a high-risk doctor. It makes sense. And hopefully when I see the high-risk doctor, they say, no, I don't think we need to see you. I think you're fine. And they send me back with, you know, just a regular OBGYN. And hopefully all my, test results come back fine and everything. So, guys, at this point, like, I did all I could do right now. And my next appointment is September the 3rd. Yeah, I believe it's September the 3rd. And that's going to push me for like 4 more weeks. So she said that I'm going to come back and get a checkup, and they will do a bedside ultrasound. So instead of them scheduling me to go see an ultrasound tech, the doctor's going to do my ultrasound inside the room just to make sure they don't see anything, and baby is growing. So this is like going to be a long 4 weeks, y'all. But I'm pretty sure it's going to fly by because time has been flying by. So I'm just patiently waiting to see my baby girl again. So after I end this video, guys, I'm going to upload my ultrasound. And look, guys, I did a lot of talking during the ultrasound. So beware. It was good talk. Good talk. Like the ultrasound tech, she was like so freaking nice. So we had a great conversation. So be looking forward to my 5-week ultrasound, and I'm posting this so that, people could see, what your baby looks like in this early stage, because the ultrasound tech said that she kind of surprised that they brought me in this early because they usually don't see patients until about 8 weeks. So for them to bring me at 5 weeks, she was like, they're just so early. But thank God. She told me that if we didn't see anything on ultrasound, don't get scared, don't get concerned, because I'm like, just too early. But thank God we did see a yolk sac. Now when I go back in 4 weeks, hopefully we see baby growing and see a little heartbeat. So guys, I'm still gonna just take it easy and rest, make sure I continue to eat healthy and pray. That's very important to me right now, that I continue to pray that my baby grow. So you guys just do not beep at me, because we all in this long line, sweetheart. But anyways, yeah, I'm just gonna continue to pray that my little baby continue to grow and be healthy. And I just want to thank everyone that has prayed for me on this journey, because it's been a hell of a journey. But thank God, we are here, and we got longer to go. But I'm pretty sure that, with prayers and God by my side, we're gonna make it through. We're gonna be all right. So in the meantime, guys, I will see you guys soon. Continue to stay positive, prayed up for everyone that's on this TTC journey. Do not give up. Put all your trust in God. Continue to be strong, and I will see you guys soon. Love you all, and thank you for watching.